Hi, everybody. Welcome back to the Clinical Classroom. My name is Ashley, ER nurse and nurse educator. Today, I would like to talk to you about drowning. So, May is actually Water Safety Month, and as we head into the summer months where we start congregating around bodies of water like lakes, pools, oceans, I thought it'd be really important for us to talk about water safety and drowning, which tends to be a more catastrophic thing that we see in our emergency departments. Drownings are actually the leading cause of death for children and young adults. Specifically, it's the leading cause of death for children ages 1 to 4. Drowning can be known as a silent death. It happens quickly and quietly. With that, let's head into the 3 types of drowning. I think it's important first to dive into what drowning is specifically, because drowning is the process of experiencing respiratory impairment as a result of submersion or immersion in liquid. So now that we have a definition, we can go into those 3 types of drowning. So the first one is going to be fatal drowning. That means the result of the immersion or submersion in water resulted in the patient dying. The second type is going to be non-fatal drowning with injury. That means these patients have complications, whether they're long-lasting or short. Respiratory or neuro tend to be the 2 major complications associated with this type of drowning. Then the third type of drowning is non-fatal drowning without injury. So that's the most optimal outcome, right? So now that we talked about the 3 outcomes for drowning, let's talk about the causes of drowning. So in our infant population, they typically drown in something like the tub, those little baby basin tubs, or sinks. And this is usually a result of parents' inattention or getting distracted. Toddlers and kids, however, frequently drown in pools because of a lack of safety, or they've escaped and gotten away from parents' attention or caregiver of some sort. Safety things would be like rails around the pool, ladders, alarms. When those things aren't in play, it's easier for children to get into a body of water. And typically, this group doesn't have like the swimming skills to be able to get to safety. Additionally, toddlers' heads are much larger than the rest of their body and weigh more, so it's easier for their heads to be submerged in water. That would then result in them drowning because of that submersion in water. So our next population of people is going to be our teens and our adults. So they tend to drown in lakes and oceans, and this occurs as a result of their thinking that they're stronger swimmers and that they can handle the body of water that they're in, but they can't. Sometimes drugs and alcohol also play an effect, or they don't have the proper safety equipment like a life vest when they're doing something like fishing out on a boat or in the ocean. It's also important to note that for our teens and our young adults whose frontal lobes aren't fully developed, sometimes we partake in riskier behavior, which results in accidents such as like diving, which in turn then causes drowning. This is the perfect segue into risk factors. So males are the most likely to drown over females. As a matter of fact, males are 2 times more likely to drown than females, and this is typically because males are more likely to engage in risky behavior over females. Again, drugs and alcohol can be a consideration in that risky behavior. The number 2 risk factor is going to be your less experienced swimmers. So I think it kind of goes without saying, if you're not an experienced swimmer, you're more likely to drown. Number 3 is going to be health conditions. So autism and epilepsy increase the risk for drowning. In the population of 65 and older, you're going to be looking at heart conditions and dementia. And then number 4 is our like other category. So when you work in the water in a high risk environment, like such as like deep sea fishing, living in a floodplain area, that also increases your risk for drowning. And living in a low income household, or not having access to swim lessons. So for the last portion, I want to talk about prevention and resources. Oftentimes we're seeing like the worst outcomes for our patients, but if we have the opportunity to do some teaching, I'm going to list some resources at the end of this that you can share with people. The number 1 prevention method is going to be swim lessons. So teaching people to swim is going to help reduce the amount of drowning. We're going to be looking at life jackets. So proper fitting life jackets that are US Coast Guard approved are really important. Number 3 is going to be safety around our pools. So this is going to be our fences, our ladders, and our alarms. Number 4 is don't swim alone. You always want to have someone else there just in case an accident happens. Someone can rescue or alert rescuers to come help you. Number 5 is supervise children. So, as we head into party season, it's really common for adults to get distracted and pay attention to their phones or do something else and not pay attention to the kids in the pool. Designate an adult who is watching and supervising the children undistracted. And last but most certainly not least, and doesn't necessarily apply to our Kubu classroom crew, is emergency preparedness. It really comes down to CPR training. So have the people in your life, especially those who are like watching your kids, um, have them get CPR trained. That way, in the event that something happens, they have the skills there to be able to help save someone's life. Thank you for tuning in all about drowning today. Stay tuned for the next video in which we're going to go over the anatomy of drowning. See you next time, guys. Bye for now.